This film is intended for eye surgeons for training and education purposes. Viewer discretion is strongly recommended.
Hi, in this video let's try to understand some of the tricks to be used while doing a carousel technique. I'll be highlighting the Phaco settings to be used in such situations. Now this is an 46-year-old young lady who has this developed cataract relatively early. She has a posterior subcapsular cataract in both the eyes, and this is the first eye which we're planning to do. The reason why I keep telling the age of the patient in every video of mine is that the eye would behave differently in different age groups. The capsule would behave differently, the nucleus density obviously would be different, and our planning should be appropriate to that particular case. In this case, I'm expecting a soft nucleus. So I'm not attempting to do any division of the nucleus. My plan is to eat the entire nucleus en masse, that's in one single piece. This is my preferred strategy in all my younger patients who are less than 45 and the nucleus sclerosis is maybe 1 or less than 1. So let's see how it's done. The two side puts are made and the rhexis is done. I made a rhexis of about 5 mm. It should be fine. It's well centered. Hydroprocedures are important. I'm going to perform the hydrodissection as well as hydrodelineation. The idea of doing a hydrodelineation is that the nuclear size gets reduced so that it can be easily prolapsed out of the bag and then emulsified. So in such eyes, softer cataracts, it's worthwhile to do hydrodelineation, but I wouldn't do it in most of my cases. These are situations where I'm trying to eat the entire nucleus en masse. This is a situation where I would prefer to do hydrodelineation. I just confirmed that the nucleus rotation is free enough. So we have a nice golden ring and now is the time to emulsify the nucleus. So let me pause here and just show what settings I'm using. The flow rate is kept at 60, the vacuum is 600, they're all in panel mode. And the power which I'm going to use is just the longitudinal power, 5%. Torsional is kept at 0. And let's see how things happen. And I'm not using the second instrument at all in this case, I'm just using the Phaco probe itself. So look at the position of my Phaco tip. Now I kept it at the edge of the rhexis margin towards my left. I'm sitting in the temporal quadrant and the bevel is facing towards the right side. The moment the vacuum builds up, you can see the entire epinucleus first comes out of the bag and gets sucked in, and now we're left with part of the nucleus to be emulsified. Again, with the high flow rate, the small nucleus just floats up and then it is also consumed at the level of the entercapsule. The entire consumption of the nucleus and the epinucleus just took this much time. And let us rewind this footage and examine it in slow motion how actually things happen. So we're not using two hands, we're just using only one hand. By using so, we are minimizing the wound leak from either of them. What it does is the effective flow rate becomes much better. So the tip is placed at the edge of the rhexis and then initially what happens is the superficial epinucleus is aspirated out and then the nucleus gets stuck into the Phaco tip. The nucleus comes out and along with it the epinucleus is aspirated in a jiffy. So the entire epinuclear sheet has got aspirated and we have got about 3/4 of the nucleus still intact. So now is the time to emulsify the nucleus. Again, because of the high flow rate, the nucleus has jumped up and it occludes the tip, the vacuum builds up and then the Phaco power energy is delivered and in a couple of seconds the nucleus is aspirated as well. So this is how we try to understand the Phaco dynamics happening when trying to emulsify the soft cataract. The cortex is aspirated out and the lens is placed inside the bag. Now let me show you the video of the same patient, other eye, which was operated about a week later. Now this is the second eye of the same patient. Let me start once the rhexis is done. The rhexis again is 5 mm. It's not big, but for this density of the nucleus, 5 mm should be sufficient. So now we need to do the hydrodissection. The cannula goes in and we can see a fluid wave coming in. The bag is decompressed by pressing the nucleus at the opposite end. And again, I'm going to do the hydrodelineation to create the golden ring. And now we have a nice separation of the endonucleus and the epinucleus. The nucleus is slightly tilting up out of the bag. I'm just putting in OVD and trying to nudge the nucleus back into the bag. Now is the time to emulsify. Again, my strategy is going to be eating the nucleus en masse. There's no attempt to divide the nucleus. The settings are going to be the same. The flow rate is going to be 60, vacuum 600, and the power is 5% longitudinal only, no torsional. The bevel is placed facing towards the right side. The superficial epinucleus is first aspirated, and then the nucleus gets engaged in the phaco tip. So I want to rotate the nucleus and get it to a right position. So just nudge the nucleus around to get it right with my second instrument. And now is the time to try the carousel technique. Again, watch the position of my tip. It is in the left edge of the rhexis, the bevel facing towards the right side. And immediately the nucleus and the epinucleus engages onto the tip. And in this case, the nucleus comes out first and it's emulsified in a jiffy. And the epinuclear sheet is still remaining within the bag. So I just go in, do a little bit of a hydrodissection. The epinucleus floats up, and then again using the phaco probe, the epinuclear sheet is emulsified in a very controlled manner. So again, let us examine this in slow motion. Initially, the superficial epinucleus is aspirated, and then the phaco tip engages the nucleus, and the entire nucleus mass just swirls around the tip and then gets aspirated out in just a matter of a few seconds. So in this case, the epinucleus did not come in the first attempt. Again, I had to just go in and redo the hydro maneuver to ensure that the epinucleus floats up, and then it was easily emulsified. So what did we learn from this case? The carousel technique works very well in younger patients with softer nucleus, but we need to use the right settings as well. In this case, we understood the importance of using a high flow rate and vacuum to ensure that the nucleus jumps in and holds on to the nucleus, and the power has to be very less. We don't want to go in with torsional energy in this case. In this case, I'm consciously using just the longitudinal energy, and that also is the most minimum aspect, that is 5%. And that was good enough to emulsify this nucleus. If we use excessive energy, we make cheese wire through the nucleus, and we may prevent the vacuum from building up. So we need to understand the phaco dynamics relative to that particular case and then apply it. So low power and longitudinal and high flow rate and vacuum. So it doesn't matter if your phacoemulsification cannot withstand a flow rate of 60 or 600. Whatever highest possible flow rate and vacuum that your machine can hold on without causing any surge, that should be fine. So even if you're using just 30 flow rate and 300 vacuum, that also should work equally well. Only thing is, ensure that you're using very less power. That was it. Thank you for watching and hope you found this helpful.